As a breath coach and trainer, I'm obsessed with trying to find out what are the things we can implement right now that can make dramatic changes to our health, in particular when it comes to our breath. And so recently I had Dr. Greg Wells on my Breathcast, and I asked him this question. I said, what can we do to make immediate changes to our lives? This is what he said. What do you recommend for the average Joe, for the average person to do in terms of breath? If somebody comes up to you on the street and said, hey, Dr. Wells, what can I do with my breath to be healthier? What sort of things would you recommend?
Go for a walk. I think that honestly, if you just get in good exercise, the drive to breathe through exercising is enough for the vast majority of people to get significant benefits. And if you consider that the 85% of the population in Canada, the US, the UK, Australia, New Zealand, all of Europe do not get enough physical activity to prevent a chronic disease, then literally the foundation, before we even begin to get into the details of specific breath work, 85% of the population just needs to move more. And the benefits for moving more, getting a little bit of exercise, 15 minutes of walking a day would be enough to reduce cancer, heart disease, cardiovascular disease, type 2 diabetes, Alzheimer's, depression, like all of these different conditions would be significantly impacted if we just simply moved our body more. And when we move our body, we breathe harder. And so our lungs positively adapt. Our blood pumps around the body. The blood positively adapts, get more red blood cells. Your heart pumps more, so your heart muscle gets healthier. Your muscles move more, so you get more muscle tissue with more myoglobin, which carries the oxygen from the air that you breathe to the actual apparatus that creates energy. Like everything gets better. Once we're doing all of that and you're getting some exercise in, then by all means, we could do some deliberate breath work. And the easiest thing I love to do in and around that is just combining some breath work with your meditation practice. So just bringing your attention to your breath. I mean, that's the fundamental thing I think the vast majority of us could tremendously benefit from. It's just even 3 minutes where you sit down in a relaxed manner, bring your attention to your breath, feel the sensation of air moving in through your nostrils, your lungs filling up and out through your mouth. And if you can just simply count your breaths and bring your attention to your breath, the power of that in terms of our mental health and the rewiring of our brain, which has been shown to happen with as little as 3 minutes of meditation a day, I think is tremendously profound. So sort of step one, just move, improve your lungs unconsciously through exercise. Step two, learn to bring your attention to your breath, build a meditation practice. And then step three, begin to become aware of how your breath can help you do the things that you love to do at a higher level. So that could be tennis. Learn to, exhale on the contraction as you hit the ball. If you're into running, learn how to breathe in rhythm with your exercise. If you are studying for an exam and you're super nervous, learn about box breathing that's used in the military to manage your anxiety levels when you're in high pressure situations. Because if it works in combat, it might work during your final year test exams, right? So we just explore breathing. We use it as a tool. We align it with what matters to us the most in our lives. But really, it's just about getting moving, getting physically active, improving our health, leveraging that as a mechanism to get all sorts of benefits: brain, lung, heart, blood, muscle, bone, skin. So I probably have a little bit more of a simplified, simpler approach than we might get into with all of the massive complexities that are available to us through different breathing mechanisms, techniques, right? I mean, we can induce full-on LSD-like states from different breathing patterns, which I've done. Like it's really quite well. You can put yourself in a full-on acid trip with a style of breathing, but I don't think the vast majority of us need to be too concerned about that. Like I've immersed myself in ice cold, freezing water in a lake in the winter in Canada for like 20 minutes through the Wim Hof breathing method, which is also super interesting, right? But I don't think most people need to go there I just think we need to go for a walk and breathe a little bit more than we normally do, and maybe take a few deep breaths when we're stressed. And that would be tremendously beneficial for like 95% of the people in the world.
So in summary, let's get up and let's go for a walk. And if we're already going for a walk, then we can add on. But what a simple, lovely thing to do. So I know what I'll be doing as soon as I finish recording this video. I'm getting straight outside with the German Shepherd. If you like that, check out the full podcast, because we go deep into a number of different topics when it comes to breath, and I always love speaking to doctors about breathing. And you may not know that the podcast, Breathcast, has moved to a separate channel on YouTube. You might be thinking, where's that Breathcast gone? So the full length episodes, the link is down below, so you can check that out and just fill your boots with breath goodness. And until then, my friends, if you're interested in going deeper with your own breath practice, then why not check out my Functional Breathing Essentials course. The link is down below. It's completely risk-free, 30-day money-back guarantee, and maybe you do me the honour of allowing me to be your digital breath coach. And week by week, in your own pace and your own time, I can take you through back to breathing the way nature intended, so that we can be functional, more efficient, and actually do things like lower feelings of stress and anxiety, have more energy, sleep better, improve heart rate variability, and a whole host of other things. I often say, if you could take all those benefits and put them in the pill, we'd all be billionaires, wouldn't we? But actually, you don't need a pill. With a little bit of education, we can actually reverse a lot of the things modernity has done to us. So check out my Functional Breathing Essentials course. And until next time, check out the podcast here with Dr. Greg Wells, or before you do that, you might want to do a little bit of breathing, a free breathing exercise. So check this out. And one of these two things should be the next thing you click. Thank you so much for watching Take a Deep Breath. I'm Mike, I'm your breathwork coach, and I'll see you on the next video. Cheers.